Hello, everybody. I'm hoping you can hear me, and I just want to welcome you today to this session this afternoon, Physio in Focus. My name is Claire Jeffries. I have the pleasure of being the chairman of AStretch and the committee of AStretch. It's a group of physiotherapists who work with AS and axial SPA patients. We work really closely with NASS, and are just absolutely delighted to be with you today for this education session for you this afternoon. So I'd like to thank you for joining us and giving us your Saturday afternoon, and obviously would like to thank NASS for hosting this event alongside AStretch. We're hoping that you're going to find this afternoon a really informative and fun session. And we have got some other physios joining us as well as AStretch, so they may be on your tables later today, and if they can just themselves, if they're on the table, to anybody that sat with them, that would be great. I'd also like to welcome and thank Phil Bateman for joining us today. He's going to be doing a presentation for you later about TMJ, so JAWS. Later on today, we've also got round discussion tables where you could come and have a chat with any of the AStretch committee members, ask us any questions. When you're on those tables, there will be other people sat around, obviously, so I'd just ask you to really respect their privacy and any comments that they may be having or discussions that you may be having on those tables, and certainly just hold their confidence after today's education sessions and discussions. There's a lot of you, so we're hoping that you all get to come and chat to us at some point. So please be mindful that there's a lot of people that may have voices today, and to make sure everybody is able to ask any questions. But overall, let's have a great day, great afternoon, have some fun, have some chat, very informal, and I'll just hand over to Jill now, so enjoy the afternoon.
Hello everyone, welcome to our Physio in Focus event. It's our final event of 2020, so I'm glad you're able to join us. Just a quick reminder, so as the presentations are on, if you use the Q&A function on the right hand side rather than the chat function to ask any questions, and if any questions come up in there that you think are good, remember to vote them up as well so that we know to ask those as a priority. And finally, just don't forget to tweet as well using the hashtag Physio in Focus. And I'll be keeping up to date with the Twitter account. So that's it from me. Now I'm just going to hand over to Sally.
Brilliant. So let's get started. And our first speaker is Will Gregory, who is consultant physiotherapist in rheumatology at Salford Royal. And he is going to be, as you can see from the presentation, he's going to be talking about how to keep motivated to exercise in or out of lockdown. And we'll have a Q&A at the end. So go on then, Will, let's hear it.
Well, thanks very much for the introduction, Sally, and thanks to NAS and to AStretch for asking me to speak this afternoon. I've been given this topic of keeping motivated to keep moving, which is very much on topic for where we are at the moment with our latest lockdown. So how do we keep motivated? And particularly, how do we keep moving within that? We've not put exercise, because exercise means different things to different people. So hopefully there's something for all of you to consider with regards to maintaining and improving your movements on this. I'm going to use the technology first off to show you a little video clip. It's a news story I'm sure you'll have seen, and the person in this video is back in the news now. But I just wanted to let you have a look at what happened a few months ago to this chap, and have a think about how they kept motivated to keep moving, what their goals were, and what the outcome was of that as well. So let's get the video going.
Approaching his 100th birthday, 100 laps of his garden during lockdown, all of the money going to NHS charities, a guard of honour from the 1st Battalion, the Yorkshire Regiment. Inches to go, and there he is. Congratulations. Well done. Absolutely amazing, amazing achievement. Captain Tom, how do you feel this morning?
Fine. I mean, yes, I mean, I'm surrounded by the right sort of people. So, yes, I feel fine. I hope you're all feeling fine too.
Well, we are feeling much more fine. I think we've all been inspired. The whole country, it seems like the whole world has been inspired by your achievement.
Oh, thank you.
Yes, quite remarkable, isn't it, really? And so what is so amazing about Captain Sir Tom Moore? Well, I thought in relation to the goal he set himself, it was quite clear, wasn't it? He was going to do 100 laps of his garden before his 100th birthday. So if we look at that in relation to being a SMART goal, it's specific because we can tell just from those 5 words what he's planning to do. It's measurable. He'll either have done 40 one day or 50 the next day, and perhaps a few days later he'll be up to 65, whatever it may be. Is it achievable? Well, he thought it was, and I suppose he must have talked to people in advance to say, do you think I could do 100 laps of my garden with my walking aid? And I suppose his friends and family would have said, yeah, I reckon you could. Is it relevant? Well, it probably is, because it gets him walking, and walking is one of the best exercises we can do. And you'll see a bit later on in my slides that it's one of the most popular ones amongst members of NASS. And lastly, is it time-based? So is there some kind of time frame in which this goal could be achieved? And he said, I want to achieve it before my 100th birthday, I think. So it fits all 5 of those components. SMART goals: specific, measurable, achievable, relevant, and time-based. I couldn't move on without saying, you know, his initial goal was, I want to raise £1,000. And we know now he's raised more than 30 million. So sometimes set your goals small and be pleasantly surprised by how they can develop if it captures the imagination. So moving on from Captain Sir Tom Moore, we're going to look at an alternative way of framing what I'd like you to think about with regards to motivation to keep moving. And we're going to do it as a rocket launch and takeoff. Perhaps not something many of us are personally familiar with, but hopefully something you can add as a framework to what we're going to talk through. So the 6 stages I've broken, sorry, the 7 stages I've broken this down into. There was a 7th one added last night with these. The 7th stage is, so first is building your rocket. The second is choosing your crew. So who's going to come with you? Who's your support? The third is packing your bags and thinking what to take with you. The 4th is the potential that it won't necessarily go perfect on first occasion. So that failure to launch, that step back. Rather peculiar, I've put in 5th the idea that you might need to fuel your rocket. So not only have you packed your bags with the things you want to take, you've also thought about what kind of energy source you need for it, what you need to keep the rockets firing as such. We'll then look at countdown to take off, and I'll hand over to you guys for all systems go, go, go. So let's have a look first off at building the rocket. So what components do we need to put together with regards to motivation to keep moving? Well, I mentioned goal setting with regards to the SMART goals that Sir Tom, sorry, I'm getting that wrong, Captain Sir Tom Moore did for himself. So can you think of an exercise or activity movement-based goal that could be set up in a SMART way? And there are different ways to frame that, and it could be worth also thinking about what you want to do, perhaps how you're going to do it, when you're going to do it, and who you're going to do it with you. Depending on how IT savvy you are, I'd welcome comments or Q&A entries on the application we're using for this meeting, and you can type in there kind of as you're listening to me if you want to, and we'll have a look at the answers that come through at the end of the talk. Being a bit more specific, well, we'll have a think about what are you currently doing, or perhaps what you'd like to do with regards to movement. Is it measurable? Is there a way of saying I've done 20 laps of the garden or 25 laps of the garden, or whatever exercise you may choose? Is it how long you've walked for, how far you've walked? Is it a certain strengthening exercise? How many repetitions have you done? Second thing, is it sustainable? Is this something that you're going to do for a few weeks and then get fed up with and not want to continue? So what kind of criteria have you put in place to make it sustainable? And that possibly links into the next one. Is it fun? So are you doing this activity with someone else? Is it a a weekly walk with a friend, if we're still allowed to do weekly walks, perhaps with just one friend within the current lockdown situation, or even if it's a Zoom-based class, who else is in the class that can make it a bit more fun and to make you actually want to go and do it? Is it sustainable with that? That ties into whether you're exercising alone or with other people, and we're all massively missing you. Those of us who run AS exercise groups, we're really missing seeing you and seeing a group of people exercising together, because it really does make it easier for everyone, that support network. So how can you compensate for that whilst our groups aren't meeting physically? Is it an online version of the AS group, or is it some other kind of online exercise? Or even is it just an accountability buddy? So an accountability buddy is somebody who you've picked out who's going to care and is also going to chase you down, so you can let them know what you have or haven't done. There was an example from our group earlier today. So Susie, who's also in the meeting and part of the AStretch team, shared with us on our WhatsApp group that she'd done just over 10,000 steps yesterday. And we all congratulated her and said, isn't this fantastic? And her response was, oh, I shared that to the wrong group. That was meant to go somewhere else. But it was still a really good way to think about accountability. How do we keep each other encouraged and boosted? And if you're doing that kind of an exercise, it's really good to be able to share what you've done with other people who can support you. Thinking about your routine, is it a fitness routine? Is it a flexibility stretch routine? Or is it working on strength? And are you showing any signs of improving those components? Or even if your goal is, are you able to maintain them? So I'd like to be as fit as I was prior to this lockdown when we come out of it in December or January, or dare I say, later than that. And then the other thing to think about with a commitment to a regular exercise activity or moving routine is what happens if you have a flare of your disease, or what happens if you're on a bad day or you're distracted by other things. How do you compensate for that? So does a flare-up mean you do less and then get back to it afterwards? Or does a flare-up completely throw you off rails and you've stopped doing it and don't really want to start again once the flare-up clears? And then lastly, is what you're doing meeting the UK physical activity guidelines, which we'll talk through in a moment? Again, if you want to put some answers in the chat box or in the Q&A section there, it gives us some things to think through at the end of today's session, or beyond if you'd like. So if that's what I'm asking what you might be doing, let's just have a look at a survey of members of NASS, which was undertaken, well, 3 years ago now. And if we look at the frequency of people reporting they're doing the exercise, like I said, in relation to Tom Moore, walking is the top one here. So 62% of you said regular walking is our activity of choice. Second was swimming with 22%. And then we go down through cycling, Pilates, exercise classes, running, gym activities, and all the way down to bowling at the bottom there. So there is a huge variety of activities that people who are NASS members are undertaking. And it can be quite surprising when you talk to other people with this diagnosis to find out what they are able to do, what they're doing as their choice. And that's something we'd recommend perhaps later this afternoon, if you are sat at a table with someone, just see what they're up to. And it's certainly not a competition. We're not looking for who's got the most exciting, random or diverse activity, but we're just trying to encourage each other and support a network where we know that any form of exercise or activity is good for you. So it's just finding the one that fits your passion and meets in with your goals, I guess. So that kind of leads into our next bit. So if we're blasting off in this rocket, we need to choose the other 5 or 6 astronauts going with us, or perhaps I preferred this image, the idea of everyone kind of rowing in the same direction to get through the choppy waters. So who do you do your exercise with? And I've mentioned the online NASS groups that are running up and down the country. Not all groups have converted to online, and that's for a number of different reasons, but some of those that are online are accepting other members from other geographic locations to come and join in for the sessions. It could be that's what you want to do, to see friends, to chat with other people, perhaps alongside the exercises. It could be you want to go online and find exercise resources to do regularly. So Claire Longton in Blackpool and Morecambe did a Twitter feed a week where she did a different exercise routine each day for her AS patients. Or it could be it's your AS physio who's doing your telephone consult and encouraging you through that means, and monitoring, supporting and being that accountability buddy as well. It could be your AS group itself. Now, obviously, this picture was taken before social distancing. I think this was a year ago at the Members' Day. But it's about who do you want to exercise with. And for some people, the obvious choice is the local NASS group, where you can meet with people with perhaps similar issues. But others of you might want to be looking at other exercise groups that are more varied in who attends. Or it could be school mums or people you work with, or a different peer group that allows you to exercise together as and when we're allowed to do that again in real life. We then think about packing our bags. So what kind of things do you need to take with you on this journey to improve your activity levels? Well, I'd suggest you need to take some evidence, some support of what you want to do. So firstly, why are we asking you to do this? And there is lots and lots of reasons for this, but if we pick out the top 7 here, well, we know those who regularly exercise and move and keep flexible will have better mobility. They'll walk further and longer and generally better physical function. We know that exercise can help with decreasing pain of AS, but also it has been shown in some cases, in some studies, to actually decrease the disease activity. And there's an argument that we make in our clinic that these new medications, the biologics and other type of drugs, are fantastic at controlling the active disease. But actually, what gets you better and gets you your life back and doing the things you want to do is the exercise you're then enabled to do, because the disease is more better controlled. But even exercise itself can have a small impact on decreasing disease activity, we think. Why should we exercise? Sometimes it's not just for the sake of getting better at press-ups or walking or whatever the exercise you've chosen to do is. Sometimes it's because it carries over into your daily life. So the things you do perhaps rather begrudgingly each morning to stretch off and loosen off, or your daily exercise routine, is there to make day-to-day life easier, so you can do the things you want to do in a more easy fashion. We know exercise within your own tolerable levels or activity will give you a mental boost and a small sense of happiness with that. This was mentioned by one of our previous NASS group feedback sessions, a small sense of happiness. Those who exercise and are kept active regularly tend to be able to reduce their medication. It has been found in the studies as well. It's not the case for everyone, but it might just allow you to better control it without so many medications. Regular exercise and activity at the right level for you does tend to lead to better sleep and less fatigue. And also, we want you to keep as strong. It's been a big push in AS that we maintain your movements. If you look at our name, we're AStretch. So we could also be called AStrength, I guess. But it is important to think about strength, stretching, and cardiovascular fitness as well. Which leads us nicely into the UK Chief Medical Officer's Physical Activity Guidelines. So this is quite a nice pictorial version of them, and it looks at what we should all be doing. So this is everyone in the population should be trying to keep physically active. And the prescription is either 150 minutes of moderate intensity exercise per week, which could be swimming, a brisk walk, cycling, or 75 minutes of vigorous activity, which could be going for a run, playing a sport. It could even be going up and down stairs if you become short of breath somewhat on that. So it's either going for a decent amount of time at moderate or a short amount of time at vigorous, or a combination of the two. And that's keeping your heart and lungs going. We think you should be building strength, perhaps 2 days a week, which could be at the gym. It could be doing something like yoga. It could be your weekly shop. It says carrying heavy bags there. So it's thinking about, is this your strength something you do separately, or is it something that's covered in your day-to-day activities? We want you to think about your balance. So perhaps balance-based work 2 days a week is recommended there. And of course, minimizing our sedentary time, which is why on this afternoon's program, we've got you getting up and doing some exercise every hour or so to make sure we're not all sat staring at a screen for the whole afternoon. So it's all very good coming up with these plans, but they don't always come off first time. And it's worth just thinking about why things might fail and what we do about it. And I was very impressed to find this face mask with the quote that I wanted on it. So massively topical, I guess. But going back a little bit, this is a very old survey in 1993, 1994, where they looked at how people having physical therapy for their AS managed to maintain it over time. So we're looking at, in the first 6 weeks, about 83% of people were still doing it. After 9 months, about 60%, and then in the subsequent 9 months, about 50% were still doing the prescribed exercise. So there is a natural tendency to drop off there. And if we come a bit more regularly, that 2017 members survey of NASS did say that people stop their exercising because of pain or because of fatigue, and that was about a third of people mentioned those two issues as being something that might limit their ability to do the exercise, the activity, the regular movements that they'd previously committed to. So it is part of the condition, and probably part of living with a long-term health condition, that sustaining things is challenging. It's interesting to go back and look at this 93-94 study. I wonder how much this exercise program was that was given to everyone. Was it too much? Was it too ambitious, and that's why people dropped off? Or was it perhaps it was harder to follow it up and encourage people and kind of maintain it from that means? So what can slow us down? Well, we're certainly at the moment, we probably all have a fair amount of lockdown lethargy. It's been going on for a while, one way or another, and shielding coming back kind of earlier this week. It's very hard work to be persistently limited in our things that we normally do for activity. And I've got a picture of somebody feeling rather stuck in their house there. And that's partly to think about that, but also stress and anxiety, which could be part of the current situation, or could just be a part of living with a long health condition, or some of the impacts of your AS that might leave you feeling that way. Time pressures are important as well. We all have lots of commitments one way or another, and finding time to do exercise or activity can be difficult. Perhaps it's been interesting for you over the initial lockdown period. Perhaps we all had a bit more time. Did we all suddenly go out and start exercising? Well, there's some stories saying that there was a lot more people jogging up and down the streets in kind of March, April, May, but then that slowed down even whilst lockdown was still ongoing. So perhaps all of us are guilty of over-enthusiastically going for an activity initially, but then losing kind of attention and focus to do it further on. So time pressures are there, but even without time pressures, how do we prioritize the things that are good for our long-term health? And the last one to mention is the expert trap. So this idea that we're never quite sure what's the best exercise for people with AS. So let's wait until I see the physio or the consultant and ask them what the best thing is for me. And it's perfectly valid that you ask us for what the best routine is, but if it means you don't do anything until you have that expert opinion, that in itself can let you down. So I think something that you do regularly, something you enjoy, and something that becomes a habit is one of the best forms of exercise, almost no matter what it is. So the expert advice is useful, but actually the way you apply it and the way you apply regular activities and exercise is important as well. So within failure to launch, I thought I should just mention this SpaceX launch, which had a problem, I think, beginning of this year or end of last year, where they had a date for the first flight and it failed. But how did that end up? Well, they did eventually do the launch. So even if you do fail, you'll replan the rocket launch, and even if the weather's not good the second time, they'll replan it a third time. So we're allowed to fail, but we're also allowed to have another go. And it's having the ability to accept that you've not managed what you wanted, but another chance to do it is probably a good idea. So this is slightly the wrong way around, and maybe the reason it failed on my previous slides was because we hadn't put any fuel in the rocket. But I just wanted to think about the things that you might pump into your activities to get best output. So we're going to look at kind of digital help first. So what things are there online? So if you're looking at exercises at home or perhaps in the gym when we're allowed to go back there, the Back to Action app or the downloads on the NASS website is a really excellent, comprehensive program of exercises to look at. If you'd rather look at some videos, then the YouTube channel that NASS runs has some really good resources, and some of that is the videos from Back to Action, but also some other videos to look through. For instance, the Stretches for Everyday Life, which is perhaps a more regular daily routine version of the exercises. And I'd highly encourage you to have a look at My AS, My Life as well, the self-management resource that NASS have recently launched that gives some tips, not only for exercise and activity, but also other ways to better improve your self-management to allow you to do those things. Moving outside of NASS resources, it could be you want to look at the Couch to 5K program, which NHS1 have launched and look after, and it very gradually takes you through a program to go from very little activity to managing 5 kilometers. Now, that may not be for all of you, but it is a way to gradually build things up. And sometimes we do need that external support to tell us how to gradually build things up, when to do a bit more and when to stay at the same level. It could be you want to look at the NHS1 other resource, which is Active 10, which looks at trying to get 10 minutes of activity per day. And that can be built up from quite simple exercises to other kind of household routines. I really like Map My Walk, which allows you to put your postcode, your house, into the resource, and then say, I'd like to do a mile's walk, or I'd like to do half a mile's walk, or I'd like to do 10 miles walk. And it'll tell you from your front doorstep where you turn, which roads you go down to get back to your house and do exactly 1 mile or 2 miles. And the reason that is quite good is we are all guilty of sometimes overdoing it. And if you know 2 miles is your average correct amount of walking, then using Map My Walk can give you different versions of that 2-mile walk from your house. So you're not tempted to go off and do a 10-mile walk and then wonder why you're a bit sore the next day or the day after. And finally, with regards to digital help, and this could be non-digital as well, actually, there are some really good apps out there or resources online to give you an exercise diary. And if we talked about accountability before, somebody you tell how many steps you've walked or how many exercises you've managed to do, and they congratulate you or they keep you accountable for it if you've not done it. Well, an exercise diary gives you an external version of that on your computer or your phone. And I've put 3 smiley stickers on your reward chart, which is quite childish, but does work surprisingly well for lots of people, that ability to feel encouragement for the things you've managed to do. Non-digital help, well, I've put the NASS group in there because eventually we will get back to our groups and we will get back to face-to-face meetings. So it's how that could work for you. It could be that the dog walk is your regular activity and exercise, and that's something that obviously you have to commit to quite regularly. Unless there's someone else in your house to walk the dog, you're going to be out 2 or 3 times a day, come what may and come what the weather might throw at us. The stretches for daily life, as I say, it's a routine that you'll find on the NASS website, but it's something you could then do regularly, having learned the plans. It could be you've got prompts around the house to think about your stretches. So myself and Gillian have worked before on this washing line challenge. She'd tweeted about the fact that she couldn't reach a washing line one spring and wondered if she'd lost some flexibility over the winter. But then actually a month later, she'd got it back and the washing line went back up to the right level. So is there something around your house, something you do regularly that you can use not only to monitor your movements, but also to encourage you when they improve? It could be you want to look at a group challenge. So a few months ago, I think it was in May, we did the Walk Your AS Off challenge. And that was really nice. Again, mostly across Twitter, but through other mediums on the website, there was a large group of people in the UK with AS or working with AS or a relative of someone with AS. And we collected our steps. And we did, I think, close to 1 million steps as a team, which is really encouraging to see how we all input a little bit into it. And there was some great conversations encouraging each other within that. And I think I've said enough about peer support and encouragement already with regards to your non-digital help. So that's your kind of fuel. That's the things that will maintain these changes. So countdown to launch. I don't think they use an egg timer at NASA, but that's the best image I could find. So just coming back to those same questions I had before, and please have these in your head for the discussion we're going to have now. Hopefully there's some Q&A coming through or some chat coming through with some of you having inputted your ideas. So what are you doing? Or what would you like to do? Is it measurable, sustainable, fun with other people? Is there accountability? Is it fitness, flexibility, strength? What happens on a flare-up, and are you meeting those UK activity guidelines? Going back to where we started with Captain Sir Tom Moore, is your plan going to be specific, measurable, achievable? Is it realistic, and is it going to be time-based? And that's probably the easiest way to think about framing things. But if you do bump into me on the streets or at meetings, or if we ever meet face-to-face, do feel free to tap me on the shoulder and tell me where you are with your rocket journey, whether you've had a failure to launch, whether you're fueling your rocket, whether you've packed your bags, or who your crew is. I might look at you a little bit quizzically initially, but I'm more than happy to be known as the Rocket Man, at least for the next 12 months, in relation to how we motivate and how we maintain and improve our flexibility, strength, and general fitness. So, all systems go. Let's see what you've got to ask and chat about in relation to that. So thanks very much for listening, and let's go to some questions from the floor.
Hello, well, thank you very much, Rocket Man. That was a brilliant presentation. Are we able to get Will up to answer a few questions? Our time is pretty short, but what we're going to do is I'll ask Will some of the questions, and then we'll get Will doing a bit of typing afterwards, answering some of the questions for us, and we'll include them when we send you an email, which will have, after the event, all the presentations in there. So for those of you who've asked, no need to take notes. So, Will, thank you. That was really good. And I think that probably the question which has come up voted highest, and I get asked all the time on the helpline, is about exercising during flares. Are you able to give a really quick and concise answer? You know, a bit of do's and don'ts during flares and exercise.
I suppose it depends how often you have your flare-ups. If it's a couple of days a month, then probably put your feet up, relax, and give yourself that time off. However, for lots of people, the flare-ups last longer, so it's modifying your routine and taking it down to 50% or something. We're all different with how we do our exercise and how we respond to it. And I think having somebody you can tell, I'm in a flare-up, I'm not doing so well, is useful. And then they'll contact you 3 days later and say, are you back on it now? Are things settled? So it is very much variable person to person, but be kind to yourself on your flare-ups. And know that you'll do more on your normal times as and when you get back to them.
Thank you. And then another question, which I also get all the time on the helpline, and I can see it has come up here, is swimming pools have been closed for a long time, opened briefly, locked down again. What suggestions do you have for activity that could replace swimming during lockdown?
Yeah, it's really hard because we know the warm water, or even a swimming pool, if it's not so warm, is incredibly valuable to keep movement going. If you are a big fan of the heat of a swimming pool, then maybe a hot water bottle, wheat pack, hot bath before you then do your exercise could be a way, if your joints allow you to do that. Hopefully it won't be too long before we're back in the swimming pools and hydrotherapy pools. And I know nationally some pools are reopening soon, despite this being locked down too.
Okay, thank you. And then the other one, which again, lots of questions, and I know is always a big issue, and that's the heel pain that comes up with AS. You know, when you can't walk around, exercise becomes, harder and harder. So is there anything that can be done for heel pain, or any exercises that you can do when you're suffering from that?
I suppose it's first to differentiate whether the heel pain is a part of your AS or whether it's something different. Is it a part of your? If it's a part of your AS, are you on the best treatments generally for your AS, your injections, your biologics, your tablets, whatever it may be? But on top of that, and in consultation with your health professional, it could be an anti-inflammatory gel that you put on your heel area before you go out and do your exercise. Or even thinking about what shoes you're wearing, or gel inserts can be quite useful just to give you that bit of support when you are active. And it's a big problem, the heel pain. And the last thing we want to see is people unable to do the exercise they'd normally achieve because of one little area. So firstly, think about your overall disease control, and then think about local work on there by maybe an anti-inflammatory gel, maybe the inserts in your shoes, and then stretching off your calves after the exercise will help to decrease that irritation, we hope.
Okay, and then quite a difficult question, I think, is how do you motivate yourself when you're struggling mentally to deal with, your diagnosis and not being able to do, what you could do before you had AS?
Yeah, it is hard if the AS has left you not as physically capable as you were. And we talk a little bit in these cases about a kind of bereavement process, and to be able to say, okay, that's the person I was before the diagnosis, and maybe I was running marathons or whatever it may have been. And if you're unlucky enough to have a situation where your AS is less well controlled and you couldn't get back to that, and we'd aim to have you all getting back to that ideally, it's how you cope with measuring yourself compared to who you were a month ago rather than who you were 10 years ago. And trying to change your mind frame to say, well, I'm better than I was. I may not be the person I was in my 20s, but actually things are improving compared to where you were more recently. It's a daily challenge to keep motivated, and I think we all have that, no matter what we're living with. But we do know in AS that exercise does make a big difference to the condition for most people. So finding that motivation somewhere is vital.
Brilliant. And I think we've got time for one more question. So how can people tell the difference between, I think what I was doing Joe Wicks, and he was always talking about DOMS, you know, the delayed onset muscle stiffness. We talked about DOMS a lot in our house. So we got bored of Joe Wicks. But how do you tell the difference between that and then maybe AS pain or having had a flare because you've exercised?
I suppose for the DOMS, it's how long it lasts, which you'd normally expect it to occur the day after and last for maybe 24, 48 hours. If it's your AS specific, perhaps it would last a bit longer as you recover from that overexertion. DOMS will be there when you're taking up a new activity, but if you've been doing that activity regularly for a while, you should have less of that muscle soreness. You may have the same amount of the AS flare, so I suppose it's persevering and see if those symptoms continue after the exercise longer run.
Brilliant. Thank you so much, Will. We're running over slightly, so I'm going to...
Yes, sorry.
No. So maybe if you are able to answer a few of the questions just with a sort of summary for us, then we'll make sure that goes out to everyone. But thank you very much. And
Thanks for having me.
Brilliant. And I'm going to go on to introduce Philip Bateman, who is an extended scope practitioner at Sheffield Teaching Hospitals. And as you can see by the presentation, he's going to be talking about how axial SPA can affect the jaw and how you can manage that. So over to you, Phil.
Hello. Today I'm going to talk about temporomandibular disorder, or TMD, and axial spondyloarthritis. My name is Philip Bateman. I'm a physiotherapist and I work for Sheffield Teaching Hospitals Trust. I'm mainly based in the outpatient department at the Royal Hallamshire Hospital. Most of my patients come from either the dental hospital and some come from the rheumatology department. I'm going to try to answer two questions. Is what is TMD? And the main focus will be on TMD and axial spondyloarthritis. Second question is how is TMD treated? And the focus will be on education and physical therapy. I'm starting with a simple definition of TMD. This is a term used for a number of clinical problems involve the jaw joint, the jaw muscles, and the jaw joints. Another name for the jaw joint is the temporomandibular joint, or the TMJ. What is the cause of TMD? Well, TMD can be associated with multiple factors. Common driving factors include facial trauma and daytime oral habits, such as nail biting or clenching the teeth during the day, sleep bruxism, which is clenching the teeth at night or grinding the teeth at night, poor posture, and emotional stress. These factors can increase muscle and joint loading. The prevalence of TMD in the general population is around 30%. That 1 in 3 of us at some point will have symptoms of TMD. Uncommon driving factors also exist, and one of these is systemic arthritis. So TMD can be associated with axial spondyloarthritis. Reported incidence of TMD involvement in AS has been disputed, varying from 4% right up to 35%. Current thinking is that axial spondyloarthritis patients who develop TMD symptoms are far more likely to have two separate conditions. In other words, their TMD symptoms are not associated directly with their systemic arthritis. Early diagnosis and intervention helps prevent development of persistent symptoms. And TMD is usually assessed by a rheumatologist, a dentist, a GP, or the patient's physiotherapist. What are the symptoms of TMD? The patient will experience pain and tenderness over the jaw joints and or the jaw muscles, pain aggravated with jaw activities such as chewing, biting, and talking, limited mouth opening, joint sounds such as clicking and creaking of the joint. And if TMD is attributed to axial spondyloarthritis, patients may experience other symptoms. Jaw symptoms may worsen with exacerbation of other systemic symptoms, and there might be signs of temporomandibular joint inflammation such as swelling, redness, and increased temperature in front of the ear. Second question, how is TMD treated? Well, guidelines for safe and effective treatments include use of conservative evidence-based treatments. And the main treatments would be education advice and optimum medication. And if the TMD, the temporomandibular joint inflammation was involved with axial spondyloarthritis, this would be via the rheumatologist. Other treatments would be physical therapy, splint therapy, and psychological support for those who need it. I'm going to focus on education and advice and physical therapy. The patient education about the disorder is crucial. So when patients come to see me, I'll be using a skull and images to help reinforce their understanding. This will help patients make sense of their disorder, reduce the threat of their symptoms, and help provide a rationale for treatment. I'll also be providing patients with information leaflets, and this will provide advice. The main thing we want to be looking at initially is what is the normal jaw rest position. As we want to avoid jaw habits such as excessive tooth contact, which cause muscle and joint loading. So we'll provide a reference point for normal rest position. And this includes a short exercise. And the main aim is for patients to remember to keep their tongue up and teeth apart. We also want patients to avoid prolonged forward head posture in sitting, because this will also include muscle and joint loading. So the main advice is don't sit for long periods without a break. Other ways you can reduce stress and strain on your jaw, joints, and muscles includes eating a softer diet while we're treating you, chewing slowly, and trying to avoid caffeine, which is a stimulant and can increase jaw activity. We also will teach a different way of yawning to initially stop the patient from overstretching their jaw, and want to avoid certain aggravating or loading postures. And if your dentist has provided you with a splint or bite appliance for your sleep bruxism, we'll be encouraging you to use that. And if the GP or the rheumatologist has provided medications, we'll encourage you to be taking your medication as prescribed. Also, regular daily exercise is very good for physical and mental health. We can provide strategies to reduce unhelpful jaw habits. One of these strategies is the use of the oral behaviour checklist. Looking at this list on a daily basis for a week and then trying to fill the frequency boxes in at the end of the week will help us find out what your driving or contributing factors are. So by the end of, after we've provided the advice and looking at the oral behaviour checklist, you'll be able to identify your own driving factors. And then we want to minimize these driving factors. And this will help to break your cycle of pain and get a better balance in the system. Another strategy to help you do this would be using something called the No Clenching app. This app will alert you to check that you're not doing your oral behaviors every half an hour or every hour. It will also alert you to check whether you have a normal rest position and to take a break from sitting. Next, we're going to look at some physical therapy techniques. And this will be for muscle tension. We want to try to reduce muscle tension, and the various ways we can do this include jaw relaxation techniques. We can provide various massage techniques to the patient to help relax the muscles and reduce pain, and send them away with exercises, particularly for the big closing masticatory muscles such as the masseter and the temporalis. For poor jaw control, we can provide various exercises to help improve jaw control. For joint stiffness, we can do manipulative therapy techniques to the patient and give them exercises to help restore temporomandibular joint mobility, and none of these techniques should be excessively painful. If symptoms don't improve, which is very rare, as TMD is a dental specialism, patients might be then referred to a dental hospital for further assessment. Also, they may undergo further investigations either by their rheumatologist or the dental hospital. And management should involve close communication between the various clinicians, particularly the rheumatology department and the dental hospital. So hopefully I've outlined what TMD is and how TMD is treated. Any questions?
Brilliant, Phil. Thank you very much. And before I start asking some questions of Phil, let me just put, apparently I have a very buzzy mic, so sorry that I have no idea how to stop that. I've moved things around and turned things off, so hopefully that will help. But Phil, are you able to come up and answer some questions for us, please?
Yes, hello.
Wonderful, thank you very much. That was really interesting.
Yeah.
One of the questions I wanted to ask, and that's sort of come up via WhatsApp, is you sort of talked about some of the, and I'm so sorry, it's so noisy in this office, so sorry if you can hear all this.
I can hear.
But yeah, we just wondered, you sort of mentioned some of the jaw exercises that people can do to sort of keep things loosened up and things. And I wondered, do you want to take us through a few? We can all have a go.
Yes. So I mean,
I'm the only one on video. So,
so yeah. So the exercises should be fairly simple, really. You know, like. But very useful. So starting with the two main exercises that we tend to start off with, apart from relaxation, is massage. And the muscle that we tend to massage is the masseter muscle. And that's because it tends to, when people get jaw pain, it tends to go into kind of a guarding cycle, we think, with many patients. So we want to reduce the activity of the muscle, because if we don't, it will cause extra activity will cause muscle pain, but it also will load the jaw joint up a little bit more, and it possibly cause pain to the joint as well. So one of the first exercises we tend to give is a very simple massage technique for the masseter. And if you look at kind of my jaw line as it comes down and then comes forward, if I clench, you'll see my masseter probably, hopefully, activated, and the muscle belly is in the corner. So the simple exercise is keeping your fingers in contact with the skin and just doing a very gentle circular kneading massage. And the important thing with massage is keeping it gentle initially and then gradually building up, but it's time and frequency that tends to relax the muscles. So that would be the first exercise for many patients I would give. The second was the control exercise, which we think does quite a lot of things. This exercise has been around for about 40 years. And what we do with this exercise, our tongue stays on the roof of the mouth with the tip of the tongue in what we call the cluck position. If I make a cluck sound, or if I make the sound of a letter N like N, stays in that, and that gives a bit more support to the jaw, and it tends to allow the muscles to relax a little bit better, the masseter muscles. So what we can do then is just a very gentle opening and closing exercise with the tongue on the roof of the mouth, and maybe with a slight support to the jaw, a guidance, because the jaw should go down and backwards. So they call it the goldfish exercise, by the way.
That's actually quite hard, isn't it?
So yeah, many of the patients that you see with pain, how their mouth will open is either it'll just open very quickly and close, or it'll open in stages. And the reason why it's because they're getting co-contraction or guarding of the muscles, and we want to kind of release that guarding and remind the brain that when I open the mouth, these muscles should just let go. And so those are two really nice exercises, I think, and you can get them from the Sheffield Teaching Hospital's website. I think I did send them to NASS as well through Zoe. Available to everybody.
We'll make sure we share those. And I think a couple of people have said, is there any kind of food you should be eating or that you should be avoiding if you're developing this problem?
Yeah, so I think the main things that we tend to ask people to avoid are, and that's just in terms of flaring, when it flares up or when we're treating patients. We obviously our main goal is to get back to normal eating, really. But crunchy food, hard foods, so meats and things like bread, like French bread and things like that. So those types of things will just take a little bit harder to bite and then harder to chew. And you might want to just break those up a little bit, or for most of the time have softer diets, like soups and pasta. But that'd be a temporary measure, really. Hopefully, after a couple of months of treatment, people will be back to their normal diets, really.
Okay, and I have heard, maybe, I don't know if this is an urban myth or it's true, but chewing gum actually can help during the day. No, opposite. Okay.
Yeah, urban myth, probably. Actually, no. To be fair, some patients do come in and say that chewing gum modifies their pain as it, in fact, most patients it'll increase the pain, but some patients swear that it'll reduce the pain. But that'd be only a temporary relief. So if you've got a sore, stiff joint and you chewing gum, the instant thing would be release and make it a bit more loose, and it'll feel better. But it's just another driving factor. It's just another loading factor that we want to reduce while the patient is either flared or while we're treating them and trying to reduce the pain. It's on the oral behaviour checklist, that list of things to try to reduce. Yeah.
Brilliant. Well, I thank you very much. I can see there's more questions, but I think Jill is going to come on now to tell us what we're doing next.
I am, yes. Thank you very much, Phil. That was an excellent talk, and thank you, Will, as well, for your talk. That was great too. So we're going to move now to our round tables. Phil and Will both be on tables, so if you have any additional questions for either of them, you can go along and ask them. Also, we've got the rest of the AStretch committee as well. We'll all be on a table each. Look out for their logos, and then you can go along and ask them any sort of physio questions that you might have a nice chat there. We've also got Zoe from NASS, who will have her own table talking about the self-management program that we're planning for next year. She just wants to get some of your views, really a bit of an informal focus group. So if you want to go along and chat to her about that, that would be great. And also Laura, who's our new fundraising manager at NASS. She'll be milling around as well. So if you want to go along and talk to her about anything to do with fundraising, please do so. Sally and I will be around too. So yeah, come along and speak to us if you'd like to. We're going to be returning in at 2:50 because we're a little bit behind. So we're just going to cut 5 minutes off the round tables to try and catch up a little bit of time. And we'll see you back here then. Thank you.
Hi, sorry, my video is a bit slow. So I hope you all had a nice stretch. we're going to move on to coping with fatigue now. So I'm going to go straight across to Jane Martindale, who's going to give her share her top tips with you all. Thank you, Jane.
Good afternoon. My name is Jane Martindale, and I'm probably known to quite a few of you within NASS and certainly within AStretch. This afternoon, I'd like to talk to you about the top tips for fatigue management. And really, this has been something that I've been very, very interested in. I first started to think about this in Birmingham, actually, at one of the NASS members' days, where I was asked to present about fatigue. What I'm going to try and share with you in this short time is just a little bit about the research that's been happening over these past 5 years or so, and then to actually go through some top tips that patients have actually told us. So here we go. The first few slides are really taken from the research that has been taken from Warwick, which was led by Dr. Nathan Pearson. And some of you may well know Nathan, have been involved with some of the research that he's been doing. And part of what we tried to do is to actually come up with a questionnaire that would help us to actually understand how patients were feeling with the fatigue, because we knew at the time that all you were doing was answering between 0 and 10 for how bad your fatigue had been. These quotations here are taken again from the research, and this is about how people try to make sense of fatigue itself, because I think for everybody it's such an individual sensation that you have. And some people find it easy to talk about and describe, but other people find it quite difficult. So just looking through the quotations that participants within this research has told us may actually ring true for some of you, but may not for others. There's certainly this thing about trying to live with fatigue from a daily sense, with some days it being better than others. And for some people, it's really difficult again to maybe even tell other people about how it's making you feel. And fatigue as well can make you struggle with everyday life as well, the way that you want to get on with your life. It becomes a struggle just to actually get motivated and to start to move around and to do things. What was really interesting from the research that Nathan did was that people talked about having energy. And energy and fatigue kind of fit together, and yet do they? And a lot of the other instruments that we used to measure fatigue previously hadn't really sort of like put these into two different categories. So the questionnaire that we have come up with actually has the categories of both fatigue and of energy. And people talked a lot about lacking in energy, about how they felt their batteries had run out. And we were quite careful to think about this, because batteries running out, you think about having those little monitors where you check between green being full of energy and red being very, very low. And it would be quite nice really if we could all wear something on our foreheads that would tell people around us, you know, that maybe we're hitting their red zone and maybe just be a bit kinder to you at that time. But again, with energy, it's about being bothered, and it's about motivation that comes into all of this as well. When you have less energy, then you struggle to live your everyday life. And that was a key thing for a lot of people, in the fact that they didn't want people to see that, you know, they were lacking in energy. They're just trying to keep going. But the quotation there about drinking 12 to 15 energy drinks, please don't try and do that. But again, that's how some people had felt that they were actually able to cope with their lives at that time. One of the key things, again, from the research was about people trying to achieve a balance. And I think this is really a very, very important thing to understand, in that everybody, as they live their lives, are trying to actually integrate living with their axial spondyloarthritis, but also trying to work out how best that they can cope with their fatigue. And having balance really is a bit like scales. How sometimes if those scales are tipped, which again, we know that it's very difficult with axial SPA, because you might get flares, which again would then make things a little bit more difficult to cope with. So we talk about, and the patients talk certainly about understanding about pacing and about having a routine and having to plan. And this is really things that come from learning how to live with a condition. But when things change, such as the flares and the unpredictability about that, then that is the time when it really gets more difficult and you struggle more. And then when the balance is lost, that's when things go wrong, when people feel that they're losing control both of their fatigue and of their axbar, And it also can have detrimental effects on how people actually feel at that time, on their mood, and about this disengagement with their normal life. I talked to many people, and one of the things that they would have said is that if they feel so tired, then they would actually shun away from doing the social things, which again then started to spiral down into not being able to live a normal life that they felt they should be able to lead. So, what we as health professionals tend to do is to talk about the 4 Ps. This is making the most of the energy that you have. We talk about planning, we talk about prioritising your tasks, we talk about pacing, and we also talk about positioning. Now, there's an awful lot of the explanation behind these in the NASS leaflet about fatigue, which your wonderful Sally Dickinson and I hopefully tried to revise and to make it a lot more pertinent to people's lives. When we first looked at it, I think it was about 4 pages. Now I'm very sorry it's a small volume, but we've tried to cram absolutely everything that is out there to help people at the moment. And within there will be explanations for you about trying to plan things, trying to prioritise them, trying to help yourself to pace better. And positioning really talks about posture. So I'm trying to sit up nice and straight now. But if I was slouching, my muscles will be working and they will be losing energy. So all the things that we talk about normally can be put into making the most of your energy and all these issues that we were just about on the screen. What we tried to do as well with AStretch, but also with a small special interest group in the northwest of physiotherapists called the Assign Group, that I've been very privileged to have worked alongside now for over 12 years, was to actually go out and ask patients what they actually felt were their top tips. We called it a post-it exercise, whereby we just asked people just to jot down on a post-it what they did, what helped them to actually get through with living with their fatigue. These came into separate sections, and one of the sections was really when people talked about napping and sleeping. And I thought that this was the best one, because you'll know that all your therapists will always know best. We always do, because that's what's in our blood, really. And it's really nice to understand that actually your patients decide that maybe we don't really know best and you know best, which is actually true because you've got the t-shirt. So doing the opposite to what we're saying is probably going to work for a lot of you. So when people nap in the day, it makes them stiffer, which obviously makes loads of sense because you've got axpa. And it makes you stiffer, so therefore the pain's worse. So it's better to keep moving, which an awful lot of people do, and then go to bed perhaps a little bit earlier. And again, what another person said to reiterate that was don't nap, that makes it worse. A short 10-minute rest boosts yourself and you can keep going. There's no science behind this, it's just really what the patients who wear the t-shirt think that works best for them. One of the other key things that people talked to us about was about moving. When they're feeling fatigued, they felt that it was much better to actually get up and keep going. When they're stopping, then it's making them stiffer and it gets worse, the pain increases. So therefore, be motivated, make yourself get up and move around. Going for the walk in the fresh air. We all know that in common sense, people even without axpa know that if they get up and move around, that will increase their energy. And therefore, by increasing the energy, the fatigue feels less. So one of the things I would say is, when you're aware that your fatigue levels are starting to come or when your energy is actually dropping a wee bit, then that's the time to actually change position, move around, doing some exercise. I mean, we're always asking you to exercise, but you do that anyway because it's uncomfortable to sit for too long. But again, the other tip I learned with that was actually even at work, in the work environment, pace yourself a little bit more, be that little bit more kind to yourself and a little bit more aware of the tasks that you need to do, the ones that take more energy. Try and pace yourself so that you know that you've got the energy there ready to be able to get on with that. So we talk a bit about the general advice now. These are more sort of like, we couldn't put them into categories as such. But what people said to us with this was that once the fatigue sets in, try not to fight it. If you push through it, then it actually can make you worse. And in this case, it wiped that person out for days. So be aware of it, understand it, get to the point where you know how far you can push it and where you need to just step back a little bit more. Again, it's the pacing. It's about working hard maybe for that 40 minutes, but being prepared to rest for 10. It's very easy to say things like this, but actually the more you kind of like understand when your batteries are flagging, then that's the time to be that little bit more careful, and perhaps to just reduce the integrity of it, the intensity of it, and then be prepared to maybe sit down with a cup of tea and rest that time. Now, I think one of the key things from this, and certainly from my old research many, many moons ago, is this understanding and the sharing between yourself and your partner and your loved ones, because this is such an invisible thing to have. You can't actually describe how you feel, and it will be really difficult for me to actually understand how you feel. But just actually saying, I don't feel quite as energetic as I did, I don't feel quite as I should do, and actually being able to share that with your loved ones. It is hard, I know it's difficult, but you'll probably find that your partners actually can read you like a book. I know certainly with pain, my patients have told me many a time they don't need to say anything. The partner just picks up on it immediately like a second sense. And I think now that we're actually talking more about fatigue as well, and because of COVID-19, and we understand about long COVID and how people are suffering fatigue then, it's on the radar and people are hearing about it. We never talked about it before because there's almost stigma around fatigue. So don't be afraid of actually saying that I really don't feel quite as energetic as I did. I'm tired. That can really help, I think, sometimes as well, just to help you to overcome that little bit of that invisible barrier that's there. Having a strong cup of coffee, yeah, we all know about that one, the good caffeine fix. But it's the fact you've got up and gone to the actual kettle and made the coffee. It's the movement, it's doing something different. I think really important advice there is don't give in to it. Don't do nothing and don't dwell on it. Because fatigue, I think, can overtake you. It can take you down and drag you down. So don't let it do that. Understand that it's there, that it's a concept that we're all very much aware of now, and actually find the things that works best for you. Because I think as well, that's the hard bit, because fatigue, I think, can make people feel very, very low and very depressed and very worried. I think when you get into that sort of position, then it's harder to fight your way back out of it. But all of the things that we're asking you to do there about the 4 Ps are all things that you need to do for yourself, which again is something that is being kind to yourself and something that we need to probably do a little bit more of. I think especially in these days that we're actually facing, I've said the horrible word COVID-19, and it does keep cropping up because we're all having to live with it. So remembering to this, be kind to yourself. Fatigue is very, very real, and it's very, very variable day to day. And I think the stigma around fatigue is actually beginning to lift a little bit now as well. So rather than you kind of like keeping it to yourself, then I think being empowered to actually talk to your clinicians and to your therapists about fatigue is something that really we should be doing, that the dialogue should be opened a lot better now. Eat and sleep well, taking care of ourselves again is another really important thing. And I know with our exercise, with patients as yourselves, you're the experts on that. You know what you need to do to keep moving. If you hate the word exercise, I just say move around. Just stretch and move and keep going. Active relaxation sounds a bit odd, doesn't it, really? But I think active relaxation really, to me, means that you actually are taking time out to actually relax and relax properly and give relaxation, you know, a really good sort of like goal. It's easy to just sit down and look at the sky, but actually sitting down and being kind to yourself and looking at the sky and allowing your mind to wander can actually be something that be very, very empowering. And enjoyment. I know socially we're all getting locked down again, so it's very difficult. We can socialise through this medium. We can also socialise in other ways, as in with talking to our friends, and probably talking to our friends more than we have done in an awful long time. And being solitary as well, enjoying things. I think I've read more, certainly in the past few months, than I've done for a long time, because it's like escapism as well that helps us to maybe forget about the horrible times that we're going through. We keep talking about these 4 Ps, and they are important. But it means that you have to actually take time out to try to do this. You have to look at your life and how it stands. You have to plan what activities you can do and plan them so that they are actually doable, achievable goals rather than being the whole thing. About pacing, about not being afraid to take a rest and not feel guilty that you're taking a rest as you're doing it. The prioritisation is really important. Do the windows really need cleaning? 3 times a month inside, because nobody's going to be able to come in your house now anyway, so who cares? And posture, again, being very, very mindful of your posture and making sure that at all times that you're doing things as best you can for your body. Set these achievable goals and make them meaningful, and be kind to yourself the whole time. So I hope that this has been hopefully a top tip session for you. But I also want you to maybe think about all the things that you've already been doing, because I'm pretty sure that the vast majority of you will have been doing an absolutely fantastic job about this. But don't be afraid to ask about fatigue. On the horizon, we're trying to get somebody now to finish the questionnaire that we've started to do, which will make it so that it will be available for people in clinics to fill out. Because what we're still afraid of is the fact that if we do put interventions in, if we do find a fatigue fill, which would be absolutely amazing if we possibly could, then we need to actually be able to assess if it's actually working for you. So keep your eyes open over the next couple of years. Hopefully, if we get the funding, then we'll finish the questionnaire and people will be able to tell us in more realistic terms about how fatigue's been affecting them and what's actually helping. So thank you very much for listening.
Hi, well, thank you so much, Jane. That was brilliant. So I can see we've got lots of good questions come up. And so if you can come up to the stage now, that would be very handy, because I can't answer them.
Hi, I'm here. Hi, Sally. Nervous moment there.
So we've got quite a short time. So
okay.
It's by quick fire round. So I think that the first one is I think the $1 million question. So what non-pharmaceutical approach is best or has most evidence for managing fatigue in AS? Would you say exercise, or are you going to go somewhere else?
I'm going to say that I think that's only answerable for each and every individual. I think we're all so unique. If we had the fatigue pill, it would be fantastic, but we haven't got that. It's got to be, I think, a little bit of trial and error. You've got to see what works best for you, and actually to understand that it will be variable as well. I think that's the hardest part with this. So I've no answers, but I think explore. Don't be afraid to explore, try different things. And if one thing doesn't work, don't be afraid to move on to the next. I think the guide that we worked with together, Sally, thank you so much for doing that, is probably the most comprehensive piece of sort of like written work that we've got. But our patients were amazing. We just gave them a post-it and they wrote things down for us. And again, it's a very, very much what works is best for you. I'm sorry, I can't.
That's okay. And I think if we could answer the question, everyone's lives would be a lot easier. But if you do want that guidebook, you can find it in the resources section on the NASS website. So our next question is fatigue in AS always linked with a flare, or can you get fatigue and not be in pain and not really have a flare?
Again, there's no real hard research behind that. To be quite honest, we don't actually know. I think when people flare as well, I think it can be exhausting, because it's exhausting the fact that you've got more pain, and emotionally it can be very, very draining as well. So people do feel and report that they do feel more fatigue, yes, when they do have flare, but I think physiologically, I don't think there's anything there to understand that. One of the things I didn't say within that talk as well was sometimes with fatigue, if you start to do something else, you use another side of your brain to actually help you move into another sort of like mindset, that can sometimes help with that. So I remember at our conference that time back in Birmingham, it was a long, long time ago, we actually asked the floor, and one person said to me, he went to his Xbox, and I've since heard a fantastic lecture from a chappie up in Scotland, I can't remember his name, bless him, but he was talking about different sides of our brain actually perceive fatigue. And it's our frontal lobes, the ones that are here, that really much into that. But if you move into your motor brain, perhaps when you were doing something like an Xbox, that can really help to sort of like take that away. So there are other areas out there where the research is starting to come, but we don't really know. Sorry.
Brilliant. But I think we've got time for one more question. I'll do a nice quick one. So can medication, for example, tramadol, increase levels of fatigue?
I'm not a pharmacist, so that's one thing I would say. So I can't actually comment really on medications. I think some medications do make you feel more drowsy, certainly, and you know it's even with things like antihistamines can make you feel tired as well. So again, sorry, audience, I couldn't actually say that about that, but be aware as well that, you know, certain medications, there might be interactions there. So for the pharmacist, I could answer that better. So sorry, Sally.
I should have chosen a different question. Thank you so much. I think our time is up, and we're going to move to Claire Jeffries, who is going to explain what's going to be happening in the next session with measuring your BASME. So over to Claire.
Hello, everybody, and welcome back to. For most of you in the audience today, hopefully you're aware of the BASME, or the Bath Ankylosing Spondylitis Index. We normally measure this with you in clinic on an annual basis, sometimes a bit more frequently if we need to. But we're mindful that for some of you this might be something new. Unfortunately, at the moment, obviously, we're not allowed to bring you in for clinic appointments to measure your BASME during the COVID-19 pandemic. There is work going on in the background to maybe look at this online, and in a minute I'm going to hand you over to my colleague Will, who will actually be undertaking some work with you to see if we can get you to measure this at home today. So the BASME allows us to look at your spinal movement and your hip movement, gives us a score out of 0 to 10, and we can see how restricted you are or how mobile you are whilst living with your axial SPA. So today, though, what I'm going to do is perhaps just talk you through a few movements do at home while we're not able to measure you in clinic, and these might be things that you want to do long term anyway, and that we recommend to a lot of our patients that we do see in our clinics. So to start with, looking at some home checks that you can do then. When should you actually check these movements? Well, basically, whenever you want to, just try and keep it roughly the same each time. So if you feel you want to test the movements in the morning, then do so. But if you feel a bit more mobile in the afternoon, you can do that as well. For those that you're going to measure against a wall or test against the wall, make sure you use the same bit of wall each time. We're going to use some books, so make sure you use the same books each time, the same pillows for the position laying down. So you get the theme. Try and keep it the same each time. Now, with regard to when to test these movements and your medication, again, it's really up to you. Some people will do it first thing in the morning. Some people like to take any medications like painkillers or their non-steroidals before they actually test this, to just give themselves a bit of a fighting chance. So the first movement we're going to look at is your chin tuck, and I'd like to say thank you to my lovely husband who became the model for these photos earlier today rather quickly. So with this movement, this is part of the BASME, so this will be really familiar to some of you. So pick a nice bit of wall, a plain piece of wall, feet about hip distance apart, with your heels, your buttocks and your shoulders against the wall. If you can, stand in that position nice and safely. You may just need your feet a little bit further away, and that's okay. What you're going to do is basically keep your eyes level and draw your chin in. So you're going to do a chin tuck and try and get the back of your head to touch the wall, the part of the head that we call the occiput. So as you can see in this picture, it isn't a forward bend of the neck or a tip back of the head. It's literally just drawing the chin backwards. Now, if you can't quite get your head to reach the wall, then what I want you to do is get hold of a book. It can be a thin book or a thicker book, whichever you prefer, and you're going to try and hold the book behind your head by tucking your chin in the same way that we've just described. So it may be that you need a thicker book to actually fill that gap, and the idea is to try and keep the book there and stop it falling down towards your shoulders. So make sure you've got a variety of books so you can try the different depths. Really challenge yourself and see if you can get down to the thinnest level of book or no book at all, but whatever you think you can do. And don't worry if you retest yourself one day and you can't quite hold the book there. It's okay. You can do some more exercises and then retest yourself and see if. Ask me why you need to do this exercise, and basically it's just fantastic for your posture. It helps you make sure you keep your chin tucked in and your shoulders back as well. So it will help you then converse with people because you've got a really good posture. It will help you look over your shoulder. It will help you raise your arm up as well because your position with your spine is in a good biomechanical position. So let's look at our next check that you can do. And this is fingertips to floor. Now, if you look in the first picture here, my wonderful model here looks as though he is touching the books really easily that are stacked up on the floor in this forward bend position. But if we actually look closely at his knees, he's got really bent knees because his hamstrings are really tight. And if we took the photo side on, as you can see, he's not quite reaching the books when he actually does this forward bend. So again, when you're doing this, make sure you've got a really good stack of books available to you so you can bend forward and get your fingertips as far as you can down towards the books. And then as you do the movement more repeatedly, or if you do some of your exercises and you retest yourself, if you find you've got a bit more flexibility, then you can just take a layer of books out each time and see how much further you can go each time you test yourself. Try not to bounce the movement though, okay? Just hold the static position. Now this test or this movement is really important because it helps keep your hamstrings really flexible, which in turn can help you keep good posture because it stops you bending your knees too much or sitting with your hips flexed. And obviously as you're bending forward, then hopefully we're moving the spine as well and keeping really good functional movement, because at the end of the day, we all do need to bend forward to load the dishwasher, tie our shoelaces, for example. So a really good test of movement. So if we look now at our next exercise, side bend. So we've got our famous pile of books again. So you want a nice comfortable chair that you can sit in nice and straight and upright. Have a pile of books at the side. Make sure you keep your buttocks on the chair. Don't be tempted to lift one buttock up, and just see if you can side bend and touch the books at the side. You may find you can get all the way down to the floor, but again, you may find that you need a few books. And as you retest yourself each time, or you do a few exercises and you feel you can go a bit further, just take a book out each time. Just make a note of how many books you've got each time so you can retest yourself a few weeks later. So this position is really good to test your spinal movement and make sure we've got this side bend. If we look at the next movement, we're looking at trunk rotation. So the same chair, see if you can back it up against a dining room table, have an object like an apple or just your phone, anything that you've got to hand. You're going to try and keep your buttocks again on the chair, and you're going to rotate round and see if you can put the object on the table behind you. Looks easy, but if you've got stiffness in your trunk, as you know, this can be quite a difficult movement to do. So remember to turn to left and right when you do it. And if you find that actually the movement is really easy, just edge your chair away from the dining room table a bit, so you have to rotate a little bit further each time. You can measure how far the chair is away from the table, so you can reset it each time you test yourself and make sure you go as far, or you can push the chair a little bit back again to make it a little bit harder for you. When you do the movement, make sure you allow your head to follow your shoulders and follow the movement of your trunk. So this exercise or test for your mobility is really good for your general trunk and neck mobility. And we would need this rotation for things like helping us to drive, or if somebody calls us or we're looking over our shoulder to see what's behind us. So the next movement you can then test is your ability to lie flat, which we know at the end of the day particularly can be a real problem for us. So get a pile of pillows, find a nice comfortable, perhaps quiet place in your house. You're going to just try and lay down on your back. And this can be on the floor if you want to, or it can be on your bed, whichever you prefer. So have a stack of pillows that you know will support your head and neck, so you're not kind of holding your position or overstraining your neck muscles, and just lay there for a few minutes. And then gradually see if you can take a pillow out. And then a few minutes later, take another pillow out. And then if you can, see if you can get your head flat to the floor with no pillows at all. Now, expect to be a bit different day to day on this one, and take your time. You could lay here for a good 15, 20 minutes if you can, just gradually allowing your spine to extend. Now, this exercise and test is really good to make sure that we can extend our spines and get in a really nice straight or neutral spine position. So it's good for helping you keep good posture, and particularly to relax at the end of the day after we've spent a whole day fighting against gravity, which naturally tries to bring us forward into that flex position. So the next movement to look at as well, and I'm not going crazy, this isn't about young children getting AS, this is just to perhaps consider measuring your height at home and doing this with your children or your grandchildren just to make it a little bit of fun for them and for you. So you could mark on a particular wall or just use a tape measure, making sure again that you're trying to stand against the wall with your heels against the wall, your buttocks and your shoulder blades if you can, but predominantly making sure that you're safe and as close to the wall as you can get. So just measuring your height against the same bit of wall, morning or afternoon, whichever you prefer, or into the evening, but just trying to use the same bit of wall and same position each time, just to really check your posture, make sure you can keep your chin tucked in and your shoulders back and that really good neutral spine. The next one is to look at an arm reach and just simply trying to reach up to the door frame, whether it be right up to the top of the door frame if you can get your arm that high, or just as far as you can up the side of the door frame. Again, you could just mark it slightly if you wanted to, or just take a visual note of how far you're able to reach and just retest yourself each time. So this measurement or this movement to test is really good to make sure you keep good shoulder movement and arm movement overall. It will allow you to reach up to a top shelf, for example, to get a glass down for that glass of wine that you deserve at the end of the day, or your beer. And really importantly, it will help you hang out your washing as well. And hanging out your washing can be a really good test and marker in itself. And one of your members, Gillian Eames, some of you may know, set a challenge, the washing line challenge, a few years ago. And she uses this as a test to see whether she needs to do more exercises to keep her spine moving and her arm moving. So it's all really good practice. And then moving on, just thinking about your general fitness as well, you can just set yourselves little tests to see whether you're able to keep the same fitness level. So can you walk a certain distance outdoors in a certain amount of time? Maybe round the block, you could time yourself on speed and try and keep to that speed each time you're doing the walk. Can you do a certain number of steps at home if the weather's not so good outside? If and when we're able to get back into our swimming pools, can you do a certain lengths in a certain amount of time? I know some of my patients try to swim underwater for a length and they time themselves, or indeed they see how many lengths they can do in one breath. Can you cycle a certain distance at a certain speed for a certain amount of time? Can you do step-ups at home a certain number for a certain amount of time? So it's just these little things just to test yourself and see whether you're keeping the same level of fitness and the same ability each time you test yourself. So just ask yourself every now and then, am I having to push my car seat further back? Have I had to adjust my mirrors slightly? Does that mean I'm losing a bit of movement? Do I need to do a few more exercises? Can I still reach up for that glass on the top shelf or in the cupboard? So some final thoughts before I hand over to Will. Just try and make sure you do your checks, your movement checks regularly, but at the same time during the day with the same equipment and in the same location. Okay, expect to be a bit variable day to day. That's okay. Use it as motivation to really keep yourself active and to make sure you can achieve the same movement or the same exercise as you did the time before. Okay, and don't forget, it is okay if you do lose a little bit of movement. Just add your exercises back in. And don't get obsessed with this. We don't want you to check it every day. Every other week is okay. Once a month is okay if that's what suits you. But just little and often would be great. So thanks for listening. Keep your checks up. And I'm going to hand over to Will.
Thanks, Claire, and hello again, everyone. So we've got a little bit of fun for you over the next 15-20 minutes, as Claire just suggested. Some of you will have done this at the start of the meeting today, 12:30 till 1:30. We had a bit of a play with this, but we're really keen to try out measuring you via a virtual platform, which isn't really happening at the moment in the country for us physios and doctors, measuring you. And is there a way to do it? Does it work doing it over video conferencing? And we'd like you to feedback on that to us, and kind of we'll discuss it ourselves to see how we felt it's gone as well. There are 7, I think, of us physios here, so we'll all be on a table up on the 2nd floor. So if you go to the left of the virtual conference on your screen, you can click number 2 to go up to 2nd floor. and find a table. Come and join us if you'd like to be measured. It's not mandatory for anyone, of course. You could stay on level 1 and have a chat to the NASS team. I know Zoe's talking about the self-management resources, or you could chat to Sally or Jill or Laura or Helen, who are all down there, or you could stay in your tables and chat to each other. If, however, you'd like to bear with us and be measured, do come on up. You'll have had the resource sent. Don't worry if you don't have it to hand. And equally, don't worry if you don't have your goniometer that we kind of created for you to hand either. But as long as you're happy to have a play around with it and see how it works. Equally, if you have a tape measure, that will make it easier. And ideally, for the measurements, you need somebody with you in the room who can look at the numbers for you. So this isn't for all of you, but we'd love to have some of you come up to the second floor and have a play around with the measures. We've got about 15 minutes, so we might get one person measured, we might get 2 people measured, but do come up in groups. There's no reason we can't measure a few people at a time around a table, or if you just want to sit on a table and observe, critique, and encourage, you'd be very welcome to do that too. So I hope that's clear. We're just about to go back into the conference room, come up to the second floor if you'd like to be measured. We're not allowed to keep your data, so this is just a practice rather than a genuine annual review for you. And similarly, please don't do anything that you don't consider to be safe as part of these measures. Thanks very much.
Hi, everyone. So, final presentation. Just a word about those videos. If you wanted to look at more of them, they're called Stretches for Your Daily Life, and they're on the NASS website section. But final presentation, we have Emily, who is very sort of appropriately for the last presentation of the day going to be talking about sleeping well with axial SPA. So over to you, Emily.
Hello, hi. So yeah, kind of the graveyard shift really, doing a presentation about sleep as the last one. So hopefully I'll try and keep you awake a little bit. It'll be quite brief. So for those of you that don't know me, I'm a physio in Bath, and until quite recently I worked at the Royal National Hospital for Rheumatic Diseases in Bath, running the 2-week residential programme we've got for people with axial spondyloarthritis. Part of that was teaching ways to sort of manage fatigue and sleep, and obviously lots of exercise as well. So also, I was involved in various bits of research around sleep and axial spondyloarthritis. So this is a bit of a whistle-stop tour about all of that in 15 minutes. So we'll go for it, and hopefully ask some questions at the end as well. I can address some of those as well. So just to touch on the things that cropped up in the research that I've done. You know, for many years, we would hear from patients coming through our doors that their sleep was disrupted, they weren't sleeping well. And so that was a research question for us. You know, was it just that we had people there and talking about their sleep and we were asking about their sleep? Or is it something to do with the condition? Is sleep particularly bad in axial spondyloarthritis? So a few years ago, so 2017, we trawled through all the research that was out there, and just to see what it tells us so far. And yeah, it seems that people with axial spondyloarthritis report high levels of poor sleep. Okay, depending on what study you look at, it can be anything between 35% of participants or 90% of people with AXPAR report poor sleep. Importantly, it's worse than compared to the control group. So it's worse than the population norms. And so it's particularly bad in AXPAR, it seems like. Other little bits and bobs that cropped up in the research with the objective sleep monitoring. So in a sleep lab where you're hooked up to brainwave monitors and electrodes measuring muscle activity, these polysomnographs that we call them. That showed that in the AES subjects, those with ankylosing spondylitis, they showed lighter sleep, it was less efficient, and people just moved around a lot more overnight compared to the control groups. So why is this? And what are the things that correlate with poor sleep? So overwhelmingly, the biggest correlating factor seems to be levels of pain, back pain, and particularly pain at night. And that mirrors what people were telling us in practice as well, that they get woken up, particularly in the second half of the night, with pain and discomfort and just that need to move around. Other things that popped up as well, particularly in our cohort in Bath with our cross-sectional study, so looking at what defined our poor sleepers, what other things were high in our self-rated poor sleepers. And we also saw that they had high levels of depression and anxiety, sort of lower mood, which, you know, you might think is not surprising really if you're not sleeping very well. But also we sort of think there might be a bi-directional relationship. So a bit like a chicken and egg, you know, if you're not sleeping well, that can cause levels of low mood, depression, anxiety. Equally, if you're anxious and have low mood, that can sometimes disrupt your sleep as well. So important to consider those psychological factors. And demographically, we also found, and this mirrors the general population as well, that women tend to sleep poorer. And also, as people age, they report poorer sleep as they get older. I think it's important to point out that it's not necessarily that people need less sleep as they get older. They just tend to get less sleep. I think there's a bit of a myth that as you get older, you just don't need as much sleep. That really isn't true. There's really very little variation between all of us. We all need between 7 to 8 hours sleep per night. Physiologically, there is not point something of the population that can truly manage sleep deprivation without any problems to their health whatsoever. It's very, very unlikely that you're that person. So it's probably that you maybe don't realise that you are sleep deprived. So what we do see that if you get under that 7 to 8 hours sleep per night routinely, and if you're actually getting a lot more than that, then that's when we see a correlation between undersleeping or oversleeping and high levels of cardiovascular disease, stroke, diabetes, and really all causes of mortality. Not to worry you so that you don't sleep, don't sit awake at night and worry about it, but really I think it's important to pay attention to that for all of us, but perhaps more so if you do have axial spondyloarthritis. Okay, so other little things that cropped up and that were hinted at in the research, that it was really just one study that showed that there is a higher prevalence of obstructive sleep apnea in the AS subjects over the age of 35. Now, if you don't know what that is, that's, and it sounds really scary, but it's not usually life-limiting. But if you just momentarily stop breathing overnight and then you'll just gasp and carry on breathing, and you might be completely unaware of this. Really, the only true and reliable measure is that the person sleeping next to you reports to you that, oh my gosh, you stopped breathing overnight, and it's usually quite scary for them. I think we typically think that it's people that snore have more sleep apnea, but really that's, from the research we looked at, that's not a good indicator of sleep apnea. So you may have it and you may be blissfully unaware. So it may be worth exploring that, particularly maybe if you wake up feeling particularly unrefreshed or groggy in the mornings. The research also hinted that there is a high level of restless leg syndrome in AS. That's where you get sort of jittery legs, really uncomfortable and just need to move those legs, and also more periodic leg movements, so jumpy legs. Also, there was another study showing there's a high level of leg cramps, so calf cramps overnight as well. With these things, there is a medical management you can go through with these. There's medications that can help with restless legs and leg cramps. And with sleep apnea, there's a little CPAP mask that you can wear overnight that gently blows air in and opens up the airways. So something to discuss certainly with your doctors. I'm a physio, so I always like to take a sort of a pragmatic approach. We're thinking of maybe some targeted stretches to your legs to keep those muscles really pliable and prevent perhaps leg cramps overnight. So you can experiment with that. So sort of addressing perhaps some of those causes, looking at things that you can do to make your environment and your body really primed for sleep. as we all usually, if I'm doing this talk, I'm saying, right, unfortunately, you have to make your life as boring as possible to make you conducive with sleep. But actually, for all of us, this is a really good opportunity because we're locked down. We can't do all the perhaps more exciting things that we'd like to. So maybe it's a good opportunity to try and get your sleep as good as you possibly can. So looking at addressing that discomfort, and this is not a scientific guide at all. This is really just from what the groups I've worked with have reported to me and things that people have experimented with. I would say on the whole, people say that if they have a firm mattress with maybe a soft topper on top, so you've got that firm base, so you're not kind of falling and slumping into an uncomfortable position, but you've got that little bit of cushioning on top to take off the pressure on your joints. That seems to be what people find most useful. Or there's a whole talk in itself about memory foam mattresses. People love them, people hate them. Someone that I know first described them as like felt like they're being eaten by a giant marshmallow when they're with a memory foam mattress. But I'll leave that up to you to experiment. But you know, it's worth bearing in mind that mattresses can be really expensive. So toppers can be a really good way of finding middle ground. In terms of positioning, if it's your SI joints or your pelvis that's uncomfortable overnight, then a pillow between your knees can be helpful, but make sure it's between your knees and between your ankles. And that should help to align your pelvis. If it's just between your knees, actually it tends to compress the sacroiliac joints, so it can make you actually more uncomfortable. So try and get that pillow in between knees and ankles. And if you're a tummy sleeper and then it's your neck that wakes you up overnight, then sometimes a nice compromise can be putting a pillow here, so you're tilted into a quarter turn, so your neck isn't on full stretch overnight. That can make it a little bit more comfortable. And then preempting that perhaps discomfort creeping in the early hours. So try to make, and if you know that's what's waking you up, try to think of the areas that tend to wake you up, and then maybe give them a little bit of a stretch or a move around before bed, so that hopefully that tides you overnight a little bit longer. And even if it gives you that extra hour, for sure that could, you know, have quite a lot of effect on your general health and well-being as well. So give it a gentle move around it before bed. So this is a little picture of what we have always called supine lying. So it's lying on your back with your legs off the bed, edge of the bed at the back of your knees. And on the NASS website and on the YouTube site, it's called the 6 p.m. stretch. It's a really good demonstration of a nice gravity-assisted stretch that can gently stretch all those areas that might wake you up overnight. So you could try that, and of course also leg stretches and calf stretches for leg cramps, warm bath to help relax those muscles, and then thinking of the timing of your medication. People tend to take it first thing in the morning to get them up and going and functioning. Yeah, that can be really important, but maybe a little bit before bed to tide you over night a little bit more again. And then thinking of those psychological factors, and this may be more pertinent than ever. Sometimes just that mental load, where we're just thinking and processing things, so try and write those down, park it before bed, resolve any conflicts. Also some breathing exercises where you're just focusing on your breathing and not about the thousands of things on your to-do list. Be really helpful for that. Don't check your emails before bed. That's always a bad idea. And just try not to use those devices before bed as well. So reducing all lights, but particularly that blue light. So switch off your devices, get those little table lamps on instead. A cool room tends to be better. Invest in earplugs and eye masks, blackout blinds and blackout curtains if you need to. They're amazing. You don't realize how good they are until you have them. And try to build the association in your brain between being in bed and being asleep. So if your brain thinks that when you get into bed, okay, this is where I sit at the and stare at the ceiling for 30 minutes, trying to get to sleep and tossing and turning, it will learn to expect that. So if you can't sleep, get up, go and do something very boring, and then come back and try and go when you're a bit sleepier and try and go to sleep then. So hopefully you're trying to consolidate as well the time that you spent in bed to when you're sleeping. Okay, so just trying to kind of keep your eyes closed and trying to grab onto those extra 5-10 minutes at the end of the day into the night isn't always helpful. And it's getting to a daily routine. So your brain can expect, okay, we go to bed at this time, we get into bed, we go to sleep, and then we get up at this time. And then if you're awake, get up. Okay, and then you get that cortisol hit, and you get up. And sometimes that can help also with fatigue. Daytime naps is a whole different topic in itself. I would say, I know people just sometimes need them to get through the day, but keep them as short as you can, 20 minutes, and ideally instead of 2 hours. Try and get active during the day when you've got natural daylight to help set that cycle as well. Hydrotherapy, yeah, really good for that as well. Look at what you're eating and drinking. Caffeine is a big culprit. Okay, trying to cut out those caffeinated drinks after lunch. I would say you'd be amazed at the impact that can have. Also, chocolate. Sorry, that also has theobromine in it, which can suppress our need to sleep. Okay, so chocolate and caffeine are real culprits for that. Alcohol is great at getting you to sleep, but will wake you up overnight. And these are some of the online resources they are. Sleepio is NHS endorsed CBT program, so it's a cognitive behavioural app, really. So it's getting you conditioned, really, and looking at all the different elements that might feed into poor sleep and trying to do that and address that systematically. Some people I know have done really well with that. Also, I think the wearable devices, so your Fitbits, other brands are available, that can be a really nice way of tracking your sleep. And if you can then map how you're sleeping and get that insight into your sleep, it can then help you try and improve that as well. So I'm a big fan of that. Further reading, so there's the Sleep Foundation, the Sleep Council, they're really good to give you more advice on sleep, much more than I've got time for today. And this book, Why We Sleep by Matthew Walker, really interesting, I think. Difficult to stay awake sometimes while you're reading it, but he does say that's fine as long as you're getting sleep. So you have to give that a read. So I think, hopefully, we've got some time for some questions now.
Hi, Emily. That was brilliant. Thank you. Yes, we do have some questions. I've seen lots of chat going on as well about pillows. So, and I know people have been swapping sort of tips on pillows, but any pillow advice that you'd give?
So you're right, it's such an individual thing, and if you find a good one, you will take it with you everywhere. I have to say, I'm a big fan of the old feather pillows. Not great if you've got allergies, but because they're moldable, and it's often this gap here that can kind of, you kind of can sink into pillows, so you can kind of roll them up and squash them in there, or just having a roll towel to get into this space here to help align your neck overnight. There are memory foam ones, and I have to say some people have said they've hated them to start with, but it's taken a while, and actually then once they get used to them, they've seen some improvement. So it might be worth giving that a go, but giving it a good go. Yeah, I like feather pillows.
Yes, and I think mattresses have also obviously come up, and I think earlier you were saying, you know, the memory foam mattresses, again, very individual, acquired taste. And I would probably just add to that, it's really good to buy a mattress from somewhere that lets you have it for a trial period, and you can return it if it's not for you.
Absolutely. Oh, sorry, just jumping in. So with the memory foam as well, you know, often we do hear people reporting they get night sweats quite a bit with those, and because the memory foam is kind of plastic, sometimes that can not be pleasant with a night sweat. So sometimes like a natural fibre on top of that can be helpful.
And is there any evidence that mattresses should be hard or soft, or no? It's just individual, what suits everyone. Okay.
No, exactly. And it's just anecdotally what people have told us for many years. But I think it's worth experimenting to see if you can find one that suits you, because like, sometimes it can be a big game changer, actually.
And I can see there's a question about mindfulness. I don't know if you'd be aware, but any sort of evidence or your views on whether mindfulness could help with sleep in AS?
Oh yeah, I mean, really good evidence for mindfulness in terms of anxiety and depression and those elements, and just that mental processing. I think it's very individual. You know, if you sort of, I think first step is to work out for you what are the main things that are affecting your sleep. And if it's just that kind of your brain going a million miles an hour, or just if you think that's an element, it has to be only a factor, but sometimes an element, then yeah, having that structured, often they're focused around breathing. And I think that can be really useful. Absolutely, I think it's worth exploring, and they're inexpensive. We know they're generally good for you in terms of reducing your stress levels as well. And so that supine lying stretch I was showing as well, sometimes people do their breathing with that can help that wind down and relaxation before bed.
Okay, brilliant. And I can see there's lots of questions about medication on there, which I won't ask you as I did for Jane. I put her on the spot. So I think probably that's a question best asked maybe of your GP or your rheumatologist, if you're happy with that. And then probably just the final question then, which someone's asking, Rebecca's asking, did you say someone had done an observational study in a sleep lab for people with axial SPA, and would you be able to sort of pop a reference for that in, maybe into the chat?
Yes, it's on my slides. I think it's a solid
one.
Oh,
okay, perfect.
At the bottom, I put them on the different ones. It's the ones that they report lower sleep efficiency and less deep sleep. So it's that one.
Okay.
Interesting study. Yeah.
Well, we'll be certainly sending all those out next week. So thank you so much, Emily. And I am going to invite Claire Jeffries and Jill Hamilton back onto the stage to sort of say thank you to everyone and to close.
Thanks, Sally. So we've come to the end of the afternoon. I don't know about you, but it's gone so incredibly quick. And I just wanted to say, to start with, thank you to all of you for joining and for being so interactive with us, for the fantastic questions. And as a liaise with NASS and try and answer some of the questions that we didn't get to, because there were loads, which is fantastic. So we're trying to get round to those over the next few weeks for you. So thank you for coming this afternoon. We hope you found it informative. I'd like to give a really big thank you as well to the AStretch committee for a fantastic job this afternoon, and for giving up their time this afternoon to be with us, and for the other physios that we had as guest speakers, to Phil and to our other physios who have been in the audience or on your tables and chatting with you as well. And finally, from the AStretch crew, I'd really like to thank NASS for giving us this opportunity to do this event with you and to try and support the patients, because that's what we desperately love to do, and we hope to try and do during the times that we find ourselves in. So thank you to NASS. And just finally, to all the patients with AXPAR and AS, make sure you stay safe, obviously, but also keep active, keep moving as much as you can, okay, and look after yourselves. So thank you very much.
Thank you very much, Claire. And so just to echo really what you said, massive thank you to the AStretch committee, giving up their Saturday and time in advance as well, getting all this event organised. It really was a great event, so thank you very much. Just want to thank Sally as well for her lovely chairing. It was very good with the question and answer. Thanks for that. We will also be staying online just until 4:30. So some of the AStretch committee will be available if you've got any burning questions in the tables. And can I just finally ask Helen, Dave and Craig to come up onto the stage, please? Don't forget, everyone, while we're waiting for these people, don't forget to fill in your feedback as well. Helen will be sending out later on today, so don't forget. So obviously, I'm sure you're all aware just how much work goes on behind the scenes, but massive thank you to Helen, who's the sort of major organizer for this event, and also to Dave and to Craig for their excellent assistance as always in the event going. So thank you very much. And that's it, really. That's all I have to say. And just have a lovely evening, everyone, and stay safe. Thank you.
Thanks, everyone.
Bye.
See you later.